And young adults. So today I want to go over a couple of simple things you can do balance-wise. And I know we've talked about these before, but it's good review for it. So first off, where do we get balance from? I always tend to think of balance almost like a sixth sense. So we have our five major senses: eyes, nose, mouth, hearing, and then touch. But I've used the example before. If I take my hand and I put it behind me and I'm not using any one of those five senses, how can I tell which way it's going? Is it going up, down? We call that proprioception, basically where my body is in space and time. And to show you what happens if that's not good, and any of you that have ever sat on your foot like this before and it starts to go numb, well, how does it feel when you first go to walk on it? It's almost like you have to walk and make sure that, hey, my foot, as I'm getting circulation back into the feet, okay, now I can tell where it's at, but when I can't, you're actually at more risk of spraining it or doing other damage. So one of them is proprioception. The other way we get balance, right in the back of our head here, our cerebellum. So when you see people being tested on the side of the road for possibly too many barley pops, they're testing proprioception via your cerebellum, and that's where they have you doing heel to toe. Last thing we get from our inner ear, or our eighth cranial nerve, it's called our vestibular cochlear. So vestibular as far as balance, and cochlear, it's also involved in hearing. And I think of those as our three main balance mechanisms. So how can I make sure that those are functioning as well as possible so I'm less prone to falls in the wintertime? Let's start with cerebellum. This is one of the things sometimes I'll even check. Let's say I'm covering a hockey game and someone got hit and boy, it looks like they have a potential concussion. Well, we'll usually assess them right away, make sure they weren't knocked out, but about 10 minutes later we'll do what's called a SCAT-5 exam, and part of that involves testing their balance. So what's a simple way to test your balance? Normally if a person wanted to try these, have a partner, someone standing next to you, or do them in the corner. If you already have balance issues, you don't want to put yourself at risk of falling. But it's some simple tests such as, can you put your hands on your pelvis like this, look straight ahead? Can you close your eyes? Can you keep them closed for 20 seconds? The idea is that you don't have to take a step. Okay, if you pass that, the next step would be hands on your pelvis. Take your dominant foot. So if I were to kick a ball, I would kick it with my right foot. So I'm going to lift my right foot up, stand on my non-dominant, stand up, and can I look straight ahead? Can I keep my balance? And you'll see my ankles shifting that, but I'm able to actually keep it. Next one is heel in front or connected to the toe. So dominant, my right leg in front of my left leg. And how is that? And I should be able to look straight ahead, keep my balance. Now I may fall a certain way, but I should be able to maintain balance. Now if I have someone that normally has good balance and they're all over the place, then I might suspect, uh-oh, do we have something going on with the head? Now as a person gets older, especially if we look at some of our adults, say age past 80 that have balance issues, notice how they walk. I call this the old person shuffle. And so with that, my first thought is, what would they look like, say, 20 years ago doing a simple balance test, things like this? And oftentimes you'll see this go years before they get to that shuffling standpoint. And so a lot of balance from that. How can I work on proprioception that way? It starts by working on the posterior columns of the spine. So if I take a look at a couple of charts I have pulled out here. So when I look at the very back of the spine, what's called anterior front of the body, posterior in the back here, you get a ton of proprioception or balance sense from your ankles, your knees, and your lower back. And so sometimes we'll see people with a chronic ankle injury on one side. They sprain it as a teenager, say maybe playing basketball. Well, if the knee can't tell what the foot has been doing in space and time, it's more prone to injury. So what do we sometimes see? Yeah, I had a sprained ankle in my teenage years, and now I started having knee problems in my 40s. Eventually I started having lower back issues. So what are some of the things I can do for working my way up to work on those proprioceptors? Well, number one, working on the feet. Am I moving them every single day? Am I spending some of the time walking barefoot? Obviously there's things like braces you can wear on a foot, but the more that you rely on them, it's kind of like wearing a cast. It supports the joint, but what does the arm and ligaments, tendons look like after? It's atrophied, the muscles have shrank. So can I get my feet on something that moves them every day? For some people after an ankle sprain, we'll have them do stuff like ABCs, working them every day. We may get them on a wobble board that tests their balance. Because just like If I test a muscle every day, or if I wanted to lift biceps every day, well, what would they look like after a month or 2 months or a year? Would get bigger. Well, you can do the same thing with balance. So the more I challenge my balance every day, the better it gets. So for the ankles, I may be doing ABCs, wobble board. That also would affect the knees as well. And then as I get to the lower back, what are some things I can do for the lower back? Well, as a chiropractor, that's one of my favorite things. If I have a patient that comes in that has balance issues, they start getting adjusted, we put them on a gym ball, and over the course of 4, 6, 8 weeks, boy, all of a sudden my balance is better. And part of that comes from just working on parts of the spine that affect those posterior columns. If I were to use something from a strength training standpoint, or as far as balance work goes, I can use something as simple as a gym ball. Okay, and this is a slightly underinflated 75 centimeter, or about 2.5 feet diameter ball. And if you look at it, when we fit people for these balls, you want to make sure the hip is slightly higher than the knee. So this is borderline too small for me. If it's way small, what it's going to do, it's going to drive the knee up. And what happens with the spine when I do that? Well, it's no different than sitting in a couch or lazy boy, which isn't good for us. But if I want to start to work on some of my balance on the back, I can watch my favorite TV program. I used to watch Nova on Wednesday nights. So let's say I click on Nova, and during it, maybe just for 5 minutes, I'll do up and down. I might do side to side, usually do 20 times. I might do big circles 20 times, and then I might go forward backwards 20 times. Really simple. If I have a half-an-hour program with commercial breaks, maybe I'm just sitting on it. And then during the commercial breaks, I go back through those range of motion. Same thing, if I'm really unstable and it's my first time on a ball, maybe I start it back into a corner like this. And then if I want to make it more difficult, there's some simple things I can do. Instead of taking a wider base, I can start to take a thinner base like this, go through all the same exercises. If I really want to make it difficult, I can start lifting, say, one leg, one arm. I can start going through it with my eyes closed. So you can make it as difficult as you want. The point being, if I challenge my balance every day, my balance gets better. If I read every day, my reading gets better. So it's really simple, easy things. By the time you have to start looking down at your feet, as far as balance goes, you're already behind the 8 ball. And the tough thing this time of year, if I fall and, heaven forbid I break a hip, if you're over the age of 65 with a broken hip, you have a 25% chance of death over the next year. So falling as we get older becomes really important to try to prevent. And this is something simple that you can work on in your home. Like I mentioned earlier, I always want to make sure that you have a good quality. This is called a burst proof ball. It's kind of gritty on it. If it gets a hole in it, it'll still go flat, but ideally it's not going to completely collapse. And the other thing, making sure that it's fit to your height. Like I mentioned earlier, if this for me is slightly, this should be inflated a little bit more. Ideally I would have my hip higher than my knee slightly. This goes the same if I work in office space. If I'm sitting all day long, yeah, I want to make sure that I'm not sitting in a chair that's too low because it puts pressure on my lower back. So something simple, easy you can do. One of the other neat things that happens with the gym ball, so we see more and more, we start seeing sideways curve. In fact, if it gets a big enough curve here and I measure the degree of this at its greatest points, if it's over 10 to 12 degrees, we can start to use that S term called scoliosis. Well, one of the interesting things that happens when they've done EMG studies, so they test the muscles, which ones are firing more. Well, you would think, well, it must be these side. It's pulling the spine here. And we find that's not true. It's actually on the outside of it. So if I'm going to get a massage or use one of those vibrating for the muscles, ideally I'd work more the high side of this. To strengthen the weak side, the tough thing, let's say, hey, I want to go to the gym, I want to start deadlifting and squatting that. Yeah, if I start working out, I will get stronger. I potentially can make the strong side stronger faster, which creates more of a dysfunction. So how would you work on this? You incorporate something that puts you unstable, like on a gym ball as far as balance goes. So even working on things like this, and I can even do different types of sit-ups, push-ups. There's a lot of ball type workouts you can do. Even if you've seen people doing stuff like this, I don't want to embarrass myself, but let's say you can do a pull-up or a push-up like this. Some crazy people stand on that. I typically don't recommend that. Most people, you're just prone to injury if you do that. There are things like Bosso balls, but even working on a gym ball, things like this can actually help if you do have a curve in your lower back to work on those weaker muscles. One of the things that I mentioned before, and we usually do this a lot with our families that come in. Even if kids aren't being seen in here, what are some of the things that parents can do for their kids? Check your kid's spine. At a bare minimum, I would check it every 6 months, ideally quarterly. But just to even check, hey, do I have something like a curve one? There's some simple things you can look at. One of them is called an Adams flexion test. So if I have a person stand like this and I have them bend down and try and touch their toes, so if I look at the spine here, when I bend down, I should see even on both sides, because you have, on top of this, you have ribs that are connected to this, and then you have the shoulder blades. Well, what happens if I have a curve in the spine? And typically what we'll see is if I had a curve in the mid-back, your backbone, the spinous process, typically rotate in like this, which is going to rotate the ribs up like this. So when I go to bend down, because I have ribs in the shoulder blade, one will show significantly higher. And if you start to see that, you're definitely going to want to try to catch it sooner than later. A lot of times, in our country, we're proactive with our teeth. Brush and floss will help you prevent cavities. But when it comes to the spine, we're more reactive than anything. In fact, most of the time, we're not taught how to take care of it. My parents taught me how to brush and floss when I was young. Well, we should teach kids how to take care of their spine. Slouching is bad for the spine. Anytime I lose the neck curve, or what's most common with our young adults nowadays, text neck, we don't see good neck curves. And the body will throw that secondary curve. So if I look at the spine, this is how you're born in the womb, born in a C-shaped curve. When babies start, doing a video, I'll get to you in a second. When I'm starting to crawl and lift up my head, I form my lower back curve and I form my neck curve. And if I don't form those curves enough, these secondary curves, my body will start to throw in a secondary compensation curve, otherwise known as scoliosis. Typically, as far as the spine goes, thinking back, I've never seen a curve in the spine with the example of I had one kid with a hemivertebrae. Basically, his body only formed, it's like a triangle. But other than that, I've seen a couple things pretty common in kids that do have spines. Girls are more common, especially girls from Eastern Asia, more prone to scoliosis. I'll usually see a flattening of the lower back curve, the neck curve, a rotated pelvis. So these are for, if you catch your kids doing this constantly, ideally at 5 years old, teach them, if you're standing on one leg, stand on the other. If you're crossing one leg, try to make sure you're standing on the other side. So I'll see that as far as the curves in the spine. Even my golfers, if I do a one-side rotational activity, let's say I'm a terrible golfer and I'm swinging 200 sometimes the same way every single time I'm out, well, over time, what can that do? In fact, even guys sitting in a wallet in their back pocket. So some of the things that we can do for patients is I can have them taking a look at the spine, or as far as parents for the kids. Number one, do that Adams flexion test, ideally quarterly, but at least twice a year. You have them bend down, try and touch the toes, make sure you don't see a high shoulder blade. You also take a look at your kid's posture down in the lower back and pelvis. Are they standing on the leg? Are they crossing the leg? Try to make sure they're switching that. As far as when I look at a person from the side, their ear, shoulder, hip, and ankle, are these in alignment, or are we starting to get this land of the slumpies? When we go over shoulders more later this year, which we're seeing a lot more shoulder injuries, well, if I exaggerate this, if my shoulders are rolled too far forward, try raising your arms. It becomes more difficult. If I go back like this, it's much easier. In fact, it's safer for your shoulders, because if I play a contact sport with my shoulders rolled like this, I'm more prone, if I get hit here, to impingement syndromes, AC separations, AC sprains. The more I go back like this, so a lot of times in here, we'll treat shoulders first from a postural standpoint. Fix this first, and then treat this secondarily. So, no getting off on a couple of tangents. For parents out there, like I mentioned, so looking from the side. Last thing, even looking in the mirror. If I look at myself, I close my eyes, march in place for a couple seconds, I should see level ears, level shoulders, and I should see a level pelvis. Okay? Getting back to other things you can do in the wintertime as far as balance is concerned, one of the easiest things, actually, so it was a few years ago, it was really icy out. We didn't have a ton of snow for ice fishing, so I actually just went in the exercise section of Walmart. I found these. These are less than $10, but basically they go over your boots and they have these little grips. Sometimes they're made of carbide tips. and I just wear these for ice fishing. Well, this past weekend I was up on Rib Mountain hiking around, and I almost ate it 3 times. You know, beautiful time. The trails are kind of packed down, but they are kind of icy, and I just had tennis shoes on. Well, not wanting to fall, I actually went back to Walmart. They were sold out, so I went to the Man's Mall, otherwise known as Fleet Farm, and I picked these up. A little pricier, a little less than 20 bucks, but these are pretty simple, pretty easy to put on. So if you look at this thicker end right here, all you do is put it on the front part of the shoe here, goes in the back there, and then I wore that. I was actually able to do some trail running without fear of falling. With these, I always try to take them off. I have wooden floors at home, so I wouldn't want to be walking on the floors at home and damage them. So right when I get done walking, even before I head back in the car, I typically pull them off. If you're really nervous about falling this time of year and you have to go to the gas station, then you just keep them on the boots as much as possible. Last thing, as far as balance is concerned, some things you probably have heard it before: walk like a penguin in the winter. So if I'm going to take a normal stride and my foot's out like this, well, then I'm a little bit more off balance, which is fine when it's dry pavement out there. But if it's not dry out, walk like a penguin is you're basically trying to keep your weight right over your feet. So you're kind of walking like this, almost this kind of shuffle. And I will do that if it's really icy. Those were just a couple things on balance. We'll be back next month with our talk on the 3rd Tuesday of the month. I hope some of these tips help you out through the end of winter, and we will talk to you guys closer to springtime.